Welcome back to East Texas Live on KETK. Well, joining us in the living room now is Amy Martin from Trinity Mother Francis.
You just heard us say, oh no, she's talking about flu vaccines, which make us nervous, but they're so important. It's important to prepare for illness. So welcome.
Hi,
Hello.
How are you?
We're good.
Thanks for having me.
Okay, so tell us a little bit about this year's shot, I guess.
Okay, well, flu season is right around the corner. We have had at least one report of a confirmed case so far this year. There are several different flu shot types that are available, and just depends on who the patient is, which flu shot is probably best for them. So
yeah, tell us a little bit about that process, because you were kind of explaining you have different ones and it's going to just depend on the individual. How do you do that?
Okay, well, we look at our senior population, so anybody over the age of 65. They tend to need a little bit of a more potent flu shot, so we use a high dose flu shot for those patients. And what's interesting about that high dose flu shot for our seniors is that we now have some literature out there that demonstrates that it does a better job than our traditional dose flu shots for preventing hospitalizations in those folks. So really good for our seniors to get that high dose if it's available. We also are offering a 4-strain flu shot. That's called the quadrivalent flu vaccine.
Okay.
And that has 2 A strains, 2 flu A strains, and 2 flu B strains. So it protects against the most variety of flu strains of any shot on the market.
How many different strains of flu are there?
Well, there's many different strains that have been described, but there's really 4 strains that circulate and cause the flu, seasonal flu that we see here in Texas and across the country.
Well, something you were saying earlier, I've had the flu before, but the flu mutates, and so it's important to still get that shot even.
Right. Even if you've had the flu shot last year, that even through this season, that there's some drift in how that flu virus can mutate, like you said. So it's really important that every year you get that shot. Additionally, the flu shot protects you for the season, so it has about a peak effectiveness of around 6 months.
Wow.
That's some new information out there that we know. So it's important to get that done every single year to protect you during the season.
Well, if you get the flu shot, can you still get the flu? I mean, is it gone?
Okay. Well, you definitely don't get the flu shot from the actual vaccine itself, but you can still get the flu. What we know about flu effectiveness is that it's 90% effective at preventing death from flu or intensive care admission from flu.
Okay.
So it's about 60 to 70% effective at preventing you from getting the flu altogether, but its biggest impact is on making sure that people aren't dying from the flu.
Yeah. So even though the shot is painful, it's important.
It's important to
just
get.
for 1 second,
Just
though.
2 seconds. It'll save you so much pain down the road.
Yeah.
Right.
And where can you get the shot at?
Okay, well, I'm excited that this year Trinity Mother Francis is offering a family flu clinic. So you can actually bring anybody 6 months of age or older can come to our family flu clinic. We're having our first one here Saturday, the 19th, at our Douglas location from 9 a.m. until 1 p.m. And we'll also be catering to some of our folks after work on Tuesday, the 22nd. From 4:30 to 6:30. So you can also get your flu shot at any of our primary care locations. And it's also available at many of your local pharmacies. So number one thing is get vaccinated.
Jump on it, guys. Don't wait till the last minute.
Right. Because flu really hits the most in November and December.
Thank you so much.
You're so very welcome.
Well, straight ahead, we are breaking down the whole